So how would I describe the 2013-14 year? I'd describe it as a great year. We absolutely started getting some really significant runs on the board, and I'm really proud of what we've done.
The board has had an amazing year, I think. It's a matter of really consolidating what we started doing in the previous year. So the board's been together now for a couple of years, and we're really in a space where we know each other and we work really well together.
The most significant and obvious thing for 2013-14 has been Sahara, or what we call Sahara around here. Sahara is the four-way alliance between us here, SAFKI Medicare Local, our Southern Local Health Network, the Consumers Health Alliance, and also SAS or SA Ambulance. This alliance is the framework for a whole heap of projects working across that interface, and already in the very few short months that we've had Sahara, it's already resulted in less presentations to the ED, lower hospital admissions, but also general practice satisfaction, so it's been fantastic.
Sahara Round 1 implemented 6 100-day projects. There were 3 task force groups that oversaw these projects. The first one was the Community Interface Task Force, and they had 2 projects. The second task force group was called the Specialist and Outpatient Care Team. The third task force group was the Emergency and Ambulatory Care Task Force.
Well, we developed a directory that helped people to understand where there are GPs that are open after hours, dentists, pharmacists, to cover a range of healthcare needs.
We got to build upon our initial work that we did to consolidate our population health planning work. That included the building of a public brand called Your Health, Your Voice, Your Choice, which was the lead in terms of helping our key stakeholders understand who we were, what we had to offer, and how they could inform our decision-making processes.
Excellent that they've involved practice nurses, practice managers and various other people in the programs. From the GP perspective, then we obviously have an obligation to keep up our CPD points, and that enables us to do that locally and easily and in a more social setting than perhaps some of the other programs available.
Grassroots general practice is an area that's not particularly well investigated or evaluated, and I think GPs often feel that their voices aren't being heard. So the Future GP project came out of a desire to really want to listen to what was happening in general practice and then try and act on that to try and improve things for GPs and improve things for the patients of those GPs.
Linking with the community in 2013-14 has just been great in that we've been able to implement some of the program work down here and see direct results. So we can see the communication between the hospital and the GPs, that sort of work. And that's what's really rewarding, and that's what makes me stay in rural and why I like working for SAFKI Medicare Local.
We continued our excellence in direct clinical services. No better demonstrated than with our Noarlunga Headspace Centre. The team and crew down there providing vital mental health services to the youth of the South has actually become part of the community and is doing really well.
One of the things that comes to mind is the launch of the Partners in Recovery program, which happened back in November last year. And that was about the same time that we were starting to take referrals from GPs and other service providers out there and clients themselves for that new program.
Kangaroo Island is also in a SAFKI Medicare Local's rural area. Last year we actually went over and did a community connections on the island, which brought all the service providers together, and we've actually followed through right through this year in helping them to revise their terms of reference for a forum over there that wasn't really connecting fly-in, fly-out providers with the local providers.
It would be remiss of me not to mention the refurb and redevelopment of our head office here at Tonsley. We already have some primary healthcare providers that have moved in, calling Tonsley their home, and we look forward to more of that in the future.
like to thank everybody that was involved in those achievements. My fellow board members, Deb Dutton, whose passion and commitment to what she does is just inspiring.
I sincerely want to thank our members and our stakeholders for sticking by us and supporting us throughout what has been a difficult year. But more importantly, I really want to thank my board and also our staff for their hard work, their passion, their drive, their commitment to primary healthcare and their true belief that it absolutely is the solution to a better healthcare system for not just South Australia, but Australia.